My name is William Stanton. I'm an orthopedic surgeon practicing in Fort Pierce, Florida. Orthopedic surgeons many times are athletes. And when I was in college, I was playing football at West Point and got injured. And then I was unable to play football and saw an orthopedic surgeon quite frequently to try to heal up some fractures and ended up, unfortunately, having to have surgery as well. And it just, it's a very common story you'll hear, but it just got me interested in orthopedics. I think because of the experience that I've had, the fact that I was an athlete, and I continue to be an athlete as much as I can, had injuries that kept me out of playing sports, I can better relate with my patients that are coming in a similar situation. The patients I'm seeing, the younger patients, are athletes. And then we have our older patients that are also athletes. But these are mainly younger and older patients that have musculoskeletal problems. And in particular, the issues that I mainly deal with are going to be knee, hip, and shoulder. For the knee, it's going to be ligamentous injuries in the younger crowd, meniscal tears in the young folks and the older people, knee replacements. And then for the hip, it's usually hip replacements and some minor trauma or even major trauma such as hip fractures. And then for the shoulder, for me, it's mainly the younger patients with athletic injury and then the older folks who have rotator cuff tears. So my approach to my patients is to treat them like family. And so I don't try to hurry them. I'm not trying to rush anybody. They're the ones with the problem. They're coming to see me to try to solve the problem. I treat them right and listen to their concerns and to the best of my ability, answer their concerns and get them going the right direction.